This video is offered solely for educational purposes. It is not intended to substitute professional medical advice, diagnosis, or treatment. If you have any medical concerns, please seek professional help at an urgent care or emergency room. First off, it is important to check that your child has their inhaler with them at all times and ensure you both are familiar on its use. Your child should be upright and place the inhaler to their lips. Press down on the canister so the medication sprays into their mouth and have them hold their breath for 10 seconds. It's recommended to repeat this process anywhere from 1 to 4 times after the initial dose. Be sure to give your child enough time in between doses so that the medicine can work properly. It is important to remove any triggers from the environment. These can include dust, smoke, pet dander, pollution, and strong scents. If possible, you should try to reduce any physical activity that could make your child's asthma worse. Remember to always have an inhaler in case of an emergency. Signs of a severe asthma attack that could warrant seeking professional care could include difficulty breathing, increased wheezing, and skin coloring that is pale or blue. If your child's symptoms persist or worsen despite treatment, then it's important to take them to the closest urgent care or emergency room immediately for proper interventions. Hopefully this video will help you to successfully treat and manage your child's asthma attack. Please like, share, subscribe, and save this video for future reference. Thanks for watching.